Hi, everyone. Welcome to today's webinar. Thank you so much for joining us. My name is Alyssa Davenport, and I serve as Six Cells Director of State Policy and Advocacy. For those of you who are new to Six Cells, welcome. We are a national advocacy organization dedicated to improving the lives of people with sickle cell disease, and we're really glad that you're here. Today, we're going to be talking a bit about Medicaid work requirements, specifically from the Medicaid Community Engagement Requirement Interim Final Rule that was just released June 1st last month and goes into effect July 31st. We want to make sure you leave today with a clear picture of what's happening and what you can do about it because we know there's been some questions. Next slide, please. So just a quick run of show. I'm going to make some introductions, and then Ryan and I are going to facilitate some or have some discussion and then facilitate some open dialogue where you can ask questions and follow up with some of the information we've provided. And as a wrap up, I want to point out our save the date for part 2 and different ways that you can engage with Six Cells as an organization. So hi, you've met me. My name is Alyssa Davenport again. I'm the newest Director of State Policy and Advocacy at Six Cells, and I'll be hosting this alongside the lovely Ryan Hill, who is the CEO and founder of Indigo Hill Strategies. So today we're going to go over the interim rule for Medicaid changes, talking about the potential changes to be enacted, the implications for the Medicaid enrollees, the impact this is going to have on the sickle cell disease community, and advocacy opportunities that we are engaging in and that you can also engage in on your own. So with that, I will go ahead and pass it over to Ryan to give some context and a deep dive into what this interim rule looks like.
Thank you so much, Alyssa. Next slide, please. Okay, so before we get into the meat of what this interim final rule says and what the potential implications are, we thought it would be great to take a step back and talk about the origins of this Medicaid interim final rule to really set the stage and give you guys context. So last year on the 4th of July, President Trump signed what's called as the One Big Beautiful Bill Act. For the purpose of this conversation, I'm going to try to remember to call it OB3 so that I don't have to say One Big Beautiful Bill Act every few seconds. OB3 is it's a big budget and policy package that touch a lot of federal programs, and Medicaid was one of them. A quick reminder for those who need it, Medicaid is a health insurance program that's run jointly by the federal government and states. It covers people with lower incomes, people with disabilities, and others who qualify for a myriad of reasons. Millions of Americans today rely on Medicaid for their health insurance. As a part of OB3, Congress directed the Center for Medicare and Medicaid Services, or CMS, to put in place new requirements for some Medicaid enrollees in order to maintain or enroll into the Medicaid program. These are what we consider work requirements. Work requirements, it's not a new idea. It's something that has been floating around the policy space, I think, really since the passage of the Affordable Care Act, or the ACA, in the 2010s. But it did have a resurgence in the OB3 conversations as a part of the potential Medicaid changes that wound up getting into the bill. And as I mentioned, now we have this final rule that is the implementation of the multiple parts of OB3 that's led to the conversation today and the release of the rule, the interim final rule that Alyssa mentioned. So just wanted to anchor us sort of in time as to what this Medicaid rule is, where it comes from, and why it's happening now. Next slide, please. Okay, so let's talk about some potential changes that are coming down the pipeline as a result of OB3 and what the rule that we're here to talk about says at a high level. So super high level, if you're between ages 19 and 64, not pregnant and on Medicaid, according to the interim final rule, you need to show that you're working, volunteering, or doing other approved activities for at least 80 hours a month. The interim final rule calls these activities qualifying activities. If you're new to Medicaid, you have to meet that same requirement for at least 1 month before you can even get approved for coverage. If you're already enrolled in Medicaid, you'll need to show that you're meeting these new qualifying activity requirements when it's time for you to renew your coverage. Super important timeline here. The interim final rule is slated to take effect at the end of next month, so July 31, 2026. That does not mean that all the changes that we're going to be talking about today, or the work requirement changes especially, are going to be live that day. What it does mean is that states will have even more information to be able to formulate their strategies, get their regulations together, all the things they need to do to implement what's coming from the Medicaid, the final rule, by January 1, 2027. So states have until January 1, 2027 to have everything in place. Next slide, please. Okay, so let's talk about some implications for Medicaid enrollees and why this is something that is especially relevant for the sickle cell community, and why we wanted to have this discussion today to walk through at a high level what this is and how we can work together to address some of these changes. Not everyone is going to be subject to this work requirement that I talked about earlier. There are some exceptions. The Medicaid Interim Final Rule has a category called medically frail or medical frailty. And if you fall into that category, you do not have to meet the work requirement. This category covers things like blindness or disability, substance use disorder, a disabling mental health condition, a physical or developmental disability that makes everyday tasks pretty difficult to achieve, and serious or complex medical conditions. That last one, the serious or complex medical conditions, is going to be really important for the sickle cell community. As you all know, sickle cell disease is a serious, complex, chronic condition. Many people living with sickle cell may qualify under one or more of these categories, which is especially important when you consider that just about 60% of sickle cell warriors in this country depend on Medicaid for their health insurance. I do want to point out, though, what I consider to be a catch with this medical frailty piece. States get to decide how they define medically frail. So, two people with the exact same diagnosis could have a very different experience depending on where they live. We've seen this sort of when we talk about how Medicaid is a jointly run program. One thing I always like to say is that when you've seen one state's Medicaid program, you've seen one state's Medicaid program. So it gives opportunity, right, to be able to make sure that folks are aware of what sickle cell looks like, of what the sickle cell experience is. But it also means that you're going to see some disparate implications for Medicaid enrollees who have sickle cell because of how different states may choose to operationalize their medical frail definition. Next slide, please. Okay, so the rule also has, for even more context, the rule also has implications for other groups that are going to be exempt from this work requirement that we've been talking about. And these groups will be fully exempt. So this includes pregnant and postpartum individuals, some American Indian and Alaska Native beneficiaries, depending on existing rules, parents and caregivers of young children or people with disabilities, as I mentioned earlier, and also people who are already meeting the work requirements through SNAP, or the Supplemental Nutrition Assistance Program, or TANF, the Temporary Assistance for Needy Families Program, which is your typical food assistance program, which varies by states, and people who qualify for short-term hardship exemptions, which again will be determined by the state. The last thing that I want to flag here is that the rule prohibits states from adding new exemptions of their own. So the list that you saw on the slide before and the list on this slide here, this is it, right? Like, states have some flexibility in how they define the categories, but they're not allowed to expand beyond the categories that we've seen here today. So that is the lay of the land on what the rule says, again, at a very high level, and who it affects. Now, the big question is, what can we do about it? I'm going to pass it over to Alyssa, who's going to walk through some of the advocacy opportunities that we have right now to make sure that the sickle cell community's voice is a part of the conversation. Alyssa, take it away.
Great. Thank you so much. So all of that information that Ryan just provided, why is this relevant for the sickle cell disease community? As mentioned, we know that over 50% of sickle cell disease warriors are enrolled with Medicaid, and that we also know that warriors do not always seek medical care or hospitalizations for every crisis, which means it doesn't necessarily get documented in a chart. Documentation is going to be really essential for this process, so it is important to keep a paper trail of your medical history and experiences. So, sickle cell disease warriors may qualify for the term medically frail exemptions by, first off, self attestation. So, you can self attest or self identify as medically frail until January 1, 2028. After this, at your renewals, your state will use the records of your medical care to verify your status as exempt. This means that if you do not use Medicaid cover sickle cell disease services, there may be less medical history documentation to rely on at a renewal. Um, you can also keep all medical documentation and contact information up to date. It is essential to include how sickle cell disease impacts your daily life and ability to work. Within your medical documentation, you should keep it as up to date as possible, including your contact information, your providers, and make sure your ICD 10 codes are throughout your documentation. Next slide, please. So, what are some advocacy, engagement, and events that we have going on? So, CMS has opened a period for public comment, which we have taken advantage of. Sick Cells, as itself, has submitted a comment letter on behalf of the sickle cell disease community, acknowledging what this work requirement would mean for the community. This was sent earlier this week. We are also planning on crafting and sending this week a community sign, or crafting this week to be sent by the deadline, a community sign-on letter for the community-based organizations, or CBOs, which we will be circulating with you all and asking for you to sign on in support. Just sort of a community coming together and notifying CMS of this rule's implications. Lastly, you can submit your own letter, which we will have a brief walkthrough on how to do, and I will distribute a toolkit following where you can submit your own comments about your own personal experiences, talking about your own story and how this rule will impact you. So, what have we done? Sickle Cell's congressional outreach. We have led efforts to relaunch the bipartisan Sickle Cell Disease Caucus in Congress, which was reignited in March. We're currently working closely with the caucus leads and staffs to do and continue member recruitment on both sides of the aisle. We are also engaging in state Medicaid office outreach in order to get a lay of the land on a state basis in order to best address the requirements on that level. The Congressional Sickle Cell Disease Briefing will be held likely in September, and it's assisting both Sickle Cell Disease Caucus co-leads, and we're assisting them on planning their first briefing. We will also have the CBCF ALC, or the Congressional Black Caucus Foundation's annual legislative conference sickle cell disease panel. We're in the process of planning an event during the CBC annual legislative conference also in September. We have our 2026 Sick Cells Coverage and Therapeutics Summit, which is a collaborative forum to discuss the changing landscapes of healthcare coverage for sickle cell disease. This is an incredible opportunity to hear directly from clinical trial participants and their reflection on the experience, hear from industry on drug and therapy pipelines, an opportunity to participate in trials, excuse me, and a discussion on the policy environment and the impact policy and regulation have on therapeutics. This is a really, really collaborative meeting that brings together payers, providers, pharmaceutical manufacturers, patient, caregiver, and advocacy groups, researchers, care teams, and policymakers. And then lastly, next year, we'll have our 2027 Sick Cells Policy Forum, where we host an annual policy forum to convene advocates for a 2-day virtual federal advocacy event. It's designed to educate, equip, and prepare advocates to engage directly with their legislators on sickle cell policy priorities and recommendations. Next slide, please. So, walking it back a little bit to talk about the public comment letters. As I've mentioned, Sick Cells has sent their own letter on behalf of the organization and the sickle cell disease community. We're happy to share the letter that we have submitted if there is any interest of that. We are also in the process of crafting a community sign on letters for you all, and we'll be distributing this throughout our CBOs, partnerships, and community to gauge support. Lastly, I encourage you to submit your own public comment on behalf of yourself and your organization. Next slide, please. So to do this is actually much more simple than it sounds. You'll go to regulations.gov and press comment, and search for the rule and press comment. You'll prepare your public comment by writing a clear and condensed comment that includes your story, how this rule will impact you, and what you'd like to see changed into the comment box. You'll fill out the required information such as contact info and who you are submitting on behalf of, whether that be yourself or your organization. Then you'll review and submit it. We will be sending out an email following this webinar that will have a toolkit that includes how to do this on a step-by-step how-to basis that you can follow along. It was crafted directly as we were going through the process ourselves, so everything should be highlighted. Next slide, please. So I want to open it up for any questions for Ryan or I regarding the rule or the implications, what's to come, etc.
Good afternoon. Hi, can you hear me?
Yes.
Hi, this is Paula, President of Jamar Warrior Sickle Cell Alliance Inc. here in Cocoa, Florida. So I'm on also the board with Florida Medicaid for All. In the event that changes occur with that, how will this be affected by this as well? Or are you waiting to see once that get completed if Medicaid is for all? So any backup plan if that got approved for Medicaid for all?
Ryan, do you have any familiarity with that?
I haven't heard of necessarily Medicaid for all in this context, but what I can say is that, as we mentioned earlier, states do have the ability to make some tweaks to how they choose to implement this, the work requirements and the final rule come January. I would really encourage you, and I know that Six Sales will have information on this as well. To think about, given your position on the board and your organization, and working with the state of Florida, how can you influence what the state of Florida is going to put out?
Okay.
And I know that, unfortunately, election years complicate everything. And then, so I know that Florida is not only we see in the midterm election in Florida, for your House and Senate seats, but also the gubernatorial seat in Florida is also up for grabs. And I would imagine that could mean a shift in their healthcare priorities from whomever does come out victorious in the governor's race. So I wish I had a better answer for you, but I do think that the key for you, Ms. Paula, may be working with the state Medicaid office to express what you all think should happen in terms of medical frailty, because states will have the ability to define some of the things that they're doing as it relates to the work requirements.
Okay, so that's my bullet point is the medical frail. Implement that, enforce that, voice about that, how it will. Okay, all right, I got it. Good, thank you.
And please stay tuned to. I think we'll do a follow up after with information. But as Alyssa mentioned, we submitted our Six L submitted our letter to our comment letter on this, where we do talk about this medical frailty piece. And so I think there'll be a lot of opportunities for some information and language sharing.
Mm-hmm.
Thank you. Okay.
Mm-hmm.
A question. I put my hand up. I don't know if you guys can see that.
Yes, ma'am.
Yes. Hi, Annie.
Hi, how's everybody doing over there? Thank you guys for all the work that you've done, and everything that you're doing on behalf of lobbying for the sickle cell community. So, my question is for those people who have a disability that are receiving Social Security,
Mm-hmm.
but they're also dually eligible for those benefits. Will they have to make changes, or will they automatically? Have you heard anything about them automatically being exempt from the
Uh,
work requirements, or they have to pre-qual?
Yeah, that's a really good question, Annie, and it's something that we've been thinking about quite a bit in terms of if you do have a disability, right, depending on what the Social Security Administration has awarded for their disability determination process. In some place, like you should be able to, because I think if we can go back to the slide on the exemptions, there was a note about disability, having disability. And I do believe that that disability determination is one that is intended to align with the Social Security Administration's disability determination process. What I would keep a close eye on, Annie, is what's going to come from HHS or CMS follow after July 31. So
Uh-huh.
as we mentioned, it's an interim final rule with a comment period, and so that's how we were able to submit comments. We're going to get the final rule some point after that, and that's
Okay.
where the states will have more information as to how to determine this. And I would imagine that if it's not called out, and forgive me for not knowing that explicitly, if it's not called
Okay.
out that there is that connection between SSA's disability determination process and the work requirements, it
Uh-huh.
should be. But I don't want to give you a hard yes on that unless someone else knows for sure. I see.
Yeah, but
I
when
think
you all get
Gabby
that
probably knows.
information, yeah, when you get that information, please, I know that you guys are
Yeah.
going to share that because I know that a disabled child, when they transition to adult, they still have to do some verification.
Yes.
And so
Yes.
I knew
Yes.
that the work requirement list came out yesterday
Yep.
for SSA.
Yes. Yes.
So making sure that folk understand it if they have a disability with
Yes.
sickle cell, what's
Mhm.
the severity of them not then being covered with
And
having to do
you
a
know
work
what?
requirement.
I also just add before we get to the other questions, that we, as in Six Cells, we were really engaged with NASM, the National Academy of Social Science, Engineering, Medicine, last year as to inform their NASM report on the intersection between sickle cell disease and disability and SSA. That
I
report came out, I think it was December or January. Forgive me,
think it
this
was
feels like the
January.
longest.
Yeah,
Yeah, thank
yeah.
you, the
We
longest year
worked with
ever.
that as
Yes,
well with
yes, yes,
SCDA. Yeah,
yes,
yeah.
yes, yes, yes. And so I know that there's been a lot of effort in order to connect the dots for the Social Security Administration. There was a congressional hearing, gosh, maybe 2 weeks ago with the SSA commissioner, a gentleman by the name of Frank Bizignano, and we were able to work with Congressman Danny Davis, who, as you guys know, is a big champion in this space, to inform his questioning of Commissioner Bizignano. And one thing that the commissioner did promise was that he would do a better job of connecting the dots between SSA, disability, and sickle cell disease. So I think there's a lot more to come there, especially from us as we dive deeper into this.
Thank you, Ryan.
Thank you, Annie. Hi, Gabby.
Hi, Ryan. How are you?
Good. How are you?
I'm good. Hi, everyone. Gabrielle Galusha with the Association of Maternal and Child Health Programs. Ryan, I was just wondering if the comment letter that you've submitted is going to be sent up in follow up, and also if we could use some of the language in our own letters. AmChip is planning on submitting a comment letter specifically on the inclusion of the medical frailty redefinition.
Mm-hmm.
And I've only been on the team for about a year and a half, and we have some involvement within sickle cell, but given the continuous conversation, I think it would be important to include within the letter. But it's not an area that I have a strong expertise in, and was interested if we could use some of your ideas that you've included in the letter in ours.
First of all, I just want to do a point of privilege here. Gabby, I can't believe it's only been a year since you've been at that job. You've been such a big champion for all this work, and we're grateful for you. Let me get with the Six Cells team. We actually just submitted the letter yesterday. And I know that the one of the goals that we wanted to do was to make sure that the letter was circulated as far and wide as possible, not only on the Hill, so that staffers and members of Congress understand sort of where we are and continue to champion the recommendations that we gave, but more broadly. And so not only do we have our letter, but we also have the community letter that Alyssa was talking about. So I think there's a lot of opportunities for coordination here, and let's stay in touch.
The only other thing I want to point out, and we can absolutely circulate it, is that we've been hearing that if comment letters are too similar in structure, so yes, absolutely use some language, but if they're too similar in structure, as in they came from an outline, the system like conglomerates it into one letter, and so it'll count as one.
Great
So
point.
that's a big part of the reason why we haven't necessarily provided an outline, because we want it to be able to come from each individual organization or individual, as opposed to it, 10 letters being sent so similarly that they only count as one.
Yeah,
That's a great point, Alyssa.
we've been hearing the same, and I definitely don't want to like copy and paste your work without in any way, shape, or form, but more so just take inspiration from the language that you all are using and figure out how to integrate it specifically for MCH populations is the angle we're hoping to take on it.
Absolutely. Thank you.
I think Paula has her hand raised. Paula?
Hi, yes. Also, just to mention, with the Medicaid for All, we are doing a campaign where I'm going to my local legislative, and I'm trying to pull a couple of people with me to go to the legislative office here in Viera, and because on July 30th, so that is the anniversary that we're going to go in our campaign and try to persuade our local legislative to vote for Medicaid for all. So that's on July 30th. So I'm on that to do and get all my resources together and collaborate with my team that I'm building. So just FYI.
We're rooting for you, Paula. Good luck.
Thank you.
Excellent. I don't see any more questions, but feel free to put them in the chat as well if you're not in a position to speak. Okay, we can go ahead and go to the next slide. And if there's any questions, we can pick back up. So I want to go ahead and make a quick plug for our webinar part 2. We're going to be updating you on what is going on in this process, as well as having fellow sickle cell disease advocates share their experience and their lived experience with this, and being enrolled in Medicaid, what this would mean for them, et cetera. So please keep in touch with us and stay up to date with what is going on as we watch through this process play out. I'll go ahead and read. Mariah's our incredible consultant. She says some states have Medicaid advisory councils and beneficiary advisory councils, where there are opportunities to attend and apply to be members of these councils to raise these questions and concerns. So that's also some good notes to have. Thank you, Mariah. And then, of course, stay engaged and keep connected with us. Please subscribe to the monthly newsletter and follow us on social media. Email us with any questions or comments, whether it is related to this or otherwise, and keep your eyes peeled for a follow-up email that will contain a myriad of resources. I will look into getting that comment letter added to that list of resources, but there'll be the toolkit for how to submit your own comment letter. There'll be a recording of this webinar, and anything else that we think is imperative for the time being. Slide. Thank you so much. If there aren't any more questions, we can give you back 30 minutes of your day. If there are any more, again, an email will be coming out. Feel free to reach out at any point to Ryan or I or anyone on the Six Cells team. We're more than happy to help navigate this new interim rule and the advocacy behind it.